Hello, everyone, and welcome to the HealthyXSundays podcast, where we bring you the most critical and actionable content in the nutrition and fitness space. Your hosts are Dev from Mind Muscle Pro and Kunal Jain, also known as Veg Diet Coach. In this episode, we are excited to welcome Dr. Vishwanath BL. Dr. Vishwanath is a distinguished physician and health wellness expert based in Bengaluru, India. He specializes in treating lifestyle diseases and promoting holistic wellness. With an MBBS and an MD from Rajiv Gandhi University of Health Sciences, he brings a wealth of knowledge to our podcast. Dr. Vishwanath has held various esteemed positions, including consultant physician and diabetologist at Satwa Specialty Clinic in Vasavi Hospital and director at neighborhood hospitals in JP Nagar, Bengaluru. He focuses on holistic wellness, therapeutic fasting, and lifestyle interventions. Please join us in welcoming Dr. Vishwanath BL to the Healthy X Sundays podcast. Welcome, Doctor.
Thank you. Thank you.
So, just a little bit about yourself. What led you to specialize in lifestyle diseases and holistic wellness?
See, when I was doing my post graduation in 2005 to 8, they were saying that diabetics also only you take a diabetic history only if somebody is above 40 years. But now the situation has changed. We are seeing diabetic even at 25, 30 years also. So after my finishing my MD, I started practicing like a regular allopathic practitioners. Usually what happens, any diabetologist, any doctor, when the patient comes now, your sugar is high, they will give a tablet or insulin to control the sugars.
Right.
So suppose if you have a fever, you have a typhoid fever, if you take a crocin or a calpol or a dolo, what happens? Fever will come down. But it is not the treatment for a typhoid fever. The treatment for the typhoid fever is antibiotic. The paracetamol is only reduce the fever. Similarly, majority doctors are controlling only the blood sugars. And nobody is looking into the root cause, what is causing blood sugar high. So giving diabetic medications and insulin is only to control the symptoms of diabetes, that is high sugars. But doctors are not actually treating the root cause of the high sugars. So this interest to address this root cause led me to read many things, maybe some research into this, analyzing the patients, what this and all. And based on this, I started low carb diet, started myself, and I started telling my patients, and finally made it a professional thing to as a part of my practice. Low carb diet, intermittent fasting, and other lifestyle diseases, wherein at least in many patients we have brought a remission of diabetes, type 2 diabetes, and in some old age patients, those who cannot maintain the diet completely, we have brought it 50% reduction of dosages. At least we make them off insulin, or we make them reduce the doses from four tablets to two tablets or two to one.
That's amazing, Doctor. So, based on your experience, like you talk about the root cause of diabetes, and what is the main driver for diabetes in India? Is it carbohydrates? Is it energy toxicity? Or is it visceral fat? Or is it genetics? There are so many reasons, but what are the top reasons in your mind as a root cause?
The top reason is 70% of the cases it is diet.
Diet.
Okay, 70% cases. In remaining 30% cases, it could be your lack of activity, it could be a stress, it could be some strong family association, and sometimes even the pollution and other things. But 70% what is causing the type 2 diabetes epidemic is the high carb diet people are eating across India, especially more so with the vegetarians, because hardly 25% vegetarians are eating proper proteins.
Right.
Otherwise, vegetarians are more protein deficient, having a protein deficient diet than non-vegetarians. Even non-vegetarians also not eating the diet properly. For example, when I see the patients, most non-vegetarians eat non-veg only weekly, twice or thrice. Rest all the meals they're eating again high carb diet only. And also non-veg also, they think that eating biryani, eating non-veg curry with rice, chapatis, again they'll indulge carbs along with their proteins. It is eating high carb diet and processed foods is the major cause of diabetes epidemic in India.
Absolutely.
Right. So, is it right to say that because of lack of protein, we are eating more carbs?
That is also one of the reason because, for example, if you are if you know how to optimize fiber and protein in your meal, automatically your intake of carbs will reduce.
Right, right.
For example, I tried this. For my patient, I practically advise these things. I'll tell them that you forget about all this low carb, keto, and all those things. I will tell about the body physiology. Your body need a fiber. Your body need a protein as per your body weight, at least 1 gram per kg body weight. And your body also need a carbs, but not in the refined form, at least unrefined forms. I tell them you follow this order. First, eat a fiber, at least 50-gram fiber in the form of simple salad or sprouts. Then eat your protein, 25 30-gram protein as per your body weight. At the last, keep your carbs. That carbs, instead of white rice, replace with red rice, minimize it. Automatically, I found that once they start a meal with a fiber and protein, their intake of carbs will reduce
Right.
because they are 50% full with the fiber and protein only. And in the dinner, tell them if you're in the dinner and all, where you're not working at all, you eat only fiber and protein. No need to eat any carbs at all. If you're serious about reversing the diabetes and reducing the weight, eat your carb only for 1 meal a day. Other 2 meals, eat only fiber and protein.
Right. So, one common pattern which we see with people is that Indians are not very fat, not obese. They are skinny fat or tofu, as we call them. Uh, but in spite of that, we tend to get diabetes. What is the reason behind that?
See that could be one thing is Indians and I do not think agree with you completely. See, I might just give an example. You see your marriage photograph of your parents' age, 30, 40
Mm-hmm.
years.
Mm-hmm.
In the entire photograph, you hardly see 1 or 2 people obese.
Mm-hmm.
You see today's marriage photographs, you see 50% people are obese.
Right.
In addition to that, there are thin individuals who are diabetic because they have a lot of visceral fat.
Mm-hmm.
What happens in this gym culture is not there in the India, especially
Mm-hmm.
somebody who are aged 50 plus now. They think that gym is not for us. The weight training is only for young people. 50 plus people in India think that they're only meant for a walking. If they go to gym, they'll have some injuries and all. The concept is not there. Automatically, after 30 years, they start losing a muscle mass. And once you lose a muscle mass, your tummy fat will start increasing.
Mm-hmm.
So both the ways, the even obese becoming diabetic and thin individual with a visceral fat also becoming diabetic, both are true.
Right. So, I think from reading your post on X, we understand that fasting insulin is a very important test. Could you just tell this for the audience?
Yeah, this is for diabetic diagnosis. People normally people do 3 tests. One is fasting sugar, second is 2 hour after breakfast, PPBS, and HbA1c. But before the HbA1c goes high, the diabetics initiation has started 10 years before. For example, your fasting insulin, or more precisely, the test called as HOMO-IR. It is a formula of both fasting glucose and fasting insulin. If these are high, then that is the time where the diabetic process has started. And from there, 10 years onwards, the HbA1c goes high. So if you can measure your fasting insulin, and if it is high, if you address at that particular point of time, then automatically you can prevent the diabetes. So still common understanding, you can say fasting insulin and HOMO-IR test are called as pre-diabetes tests. If HbA1c is a diabetes screening test, fasting insulin is a pre-diabetes test. And
Mm-hmm.
also fasting insulin not only tell you about diabetes, it also tell you about your metabolic dysfunction.
Mm-hmm.
So insulin resistance is not only leading to the diabetic, it can lead to overweight, it can link it to many cancers, it can link it to incidence of strokes. It will link to your cardiac problems and other things. So you can say fasting insulin is a pre-diabetic test as well as early predictor of a metabolic dysfunction.
So, what are some of the other tests a normal person should look for metabolic health? Not diabetes specifically, general
Okay.
metabolic health.
The basic thing is first, the basic parameters is a triglycerides. In the lipid profile, many people focus only on the like LDL. That's not true. You focus on triglyceride. If your triglyceride is above 100, you might be having a metabolic dysfunction. Your fasting blood sugar above 100 is again maybe indicative of insulin resistance. And your HDL, good cholesterol, if it is less than 50, it can indicate a metabolic dysfunction. And these are the three basic tests. And fourth is your blood pressure. Your BP is above 130/80, and your waist circumference for Indians, if it is more than 90 centimeters for a man and more than 80 for a woman. These are the five basic metabolic biomarkers everyone should look into. Still, then, if you want to look still precisely, advanced one, you can add home IR test into this.
So, coming back to the diet side of things, like a question which I have often received, and I think you also have received many times, is that what is more important? Is it about the net carbs or is it about the glycemic index or the glycemic load?
But I suggest, I prefer, because this glycemic index, glycemic load, in a common terms, many times it's both are important, but overall to guide the people, better go with the net carbs only.
Right.
Because
Because
if you reduce the net carbs itself,
Mhm.
first awareness should be created about the reducing the net carb in a whole day.
Mhm.
Then once they start reducing the carbohydrate, automatically reduce them to go for a, in the net carbs. Suppose somebody is taking Indian, suppose they're taking 250 300 grams of net carbs in a day, and an average. Suppose if they reduce it to 75 grams in a day, then after reducing the net carb, then go next level of assessing the glycemic index of the carbs they are taking.
Right.
So start with the
So
net
both are
carbs,
important.
then go with the glycemic index.
Both are important. First priority is net carbs.
Net carbs.
Okay.
Because if the carb intake is not at all reduced, the glycemic index, even the eating low glycemic index, the overall load will be high only.
So, is there any proportion of macros, like any amount of grams of carbs, etc., which you advise to your patients?
In my patients are advised with the three bowl phenomena. What I said is, your first bowl of any meal should be a fiber. Start with maybe breakfast, sprouts, salads, nuts, seeds, any kind of this, at least 50 grams approximately could be, and there is no limit for the fiber. As much you can eat, no problem. Next comes the protein. I will recommend 1 gram per kg body weight protein. If 75 kg, 25, 30 grams of protein. This is your first thing. And the carbohydrates, like I recommend only for a 1 meal in a day, preferably lunch. In the both breakfast and lunch, go only with the fiber and protein. In the dinner, in the lunch time, along with this fiber and protein, you can add little unrefined carbs like little red rice, a little millet roti, or some other unrefined forms like ragi and all, very limited form, minimal forms. It's not like I tell them as minimal as possible. See, I tell them it's because your working day, depending on your work, you can schedule, but I'm telling that your major portion should be fiber and protein. Okay, you have a small bowl of carbs.
Absolutely. So, talking about obesity, are the drivers for diabetes and obesity similar? Because we see when people start taking care of diabetes through holistic health, even the weight comes down. So, is there a connection between diabetes and obesity, underlying
Because
parameters?
the cause of both is same. It is a high insulin in the body, hyperinsulinemia. The first sugars start spiking. To control the sugars, pancreas keeps secreting insulin. So your blood is flooded with the insulin. And one particular point of time, the insulin start acting. It is like if somebody is taking a repeated antibiotics, they get an antibiotic resistance. And if somebody is continuously getting insulin from the pancreas, they get a insulin resistance. that many people know the function of insulin is to reduce the sugars. Many people doesn't know that the second important function of the insulin is to swell up the fat cells.
Right.
High insulin in the blood increases fat storage. That lead to obesity, then lead to diabetes, and sometimes both together. Sometimes diabetes may come early, sometimes obesity come later, but both go hand in hand. It's all insulin phenomena.
So, talking about visceral fat, what are the ways to reduce visceral fat?
So there's nothing specific about visceral fat. Ultimately, you have to start reducing your overall fat.
Right.
So once you start following a low carb diet with a optimum proteins and fats with a lot of fiber, automatically you start reducing that fat proportions and start incorporating other additives like intermittent fasting, a weight training, and a good sleep. All this go hand in hand in a regular, consistent manner. You can reduce the reduction of the fat. Thereby, visceral fat also get reduced.
Right. So, talking about holistic health, apart from diet, etc., what other lifestyle interventions do you recommend to your patients?
See, apart from this dietary intervention, my second recommendation is always about intermittent fasting.
Right.
See, intermittent fasting is one of the ancient technique, like any religion has followed this. So in the intermittent fasting, I'm not advising for the diabetic people already on medications. Pre-diabetic people or diabetic people who are on a safer medications, which doesn't cause low sugars. Like some diabetic medications like a DPP4 inhibitors, metformin, and a lower dose, it doesn't cause low sugars. For them, start intermittent fasting, because fasting is the one thing which double the effect of a low carb diet. Because what happens in fasting, if you're not eating anything for a 10 hours, your blood sugar doesn't rise. Obviously, there is no insulin from the pancreas. So what we're achieving through low carb diet, it is achieved better with the intermittent fasting. So the fasting encourages, the second thing is encourages exercise. Exercise, I focus more on the weight training for people, because Indians, especially people on the 40, 50 plus people are very hard to convince them for the weight training. And even for the women, many women think that they're only exercise matlab, they only have to do cardio, abdomen exercises and some running. They're also thinking that if you start weight training, they get bulky muscles, and that doesn't look go well with the women and all. So I convince them to do weight training, and other holistically, the natural way, the mental phenomena is you must encourage them to sleep well. Especially women, you have to encourage them to sleep more, 8 hours a day at least, because women has a lot of hormonal effects. So even for a men, at least 7 to 8 hours of sleep. And second thing is how you less occupied. See, if you are always occupied, busy, stressful, automatically you can't follow any of these things. Be remain with a peace, at least less occupied, little relaxed, and so that you can follow all this low carb diet and all. And I never tell any patient to follow the low carb diet in specific. I will tell them you low carb diet is a body physiological demand. You are by culture, by tradition, consuming very high carbs. Reduce it and include protein and fiber. And include this fasting and exercise, automatically goes well, and optimize your sleep and managing your stress. And last important holistic things we have to focus is removing people from negativity. See, people who are always having a hatred feeling, people who are having always having a jealous feeling, cannot remain peaceful at any stage. So
Right.
people who are like having some loving nature for others, people who are there's no jealousy, hatredness, no, they are more calm, and their body system acts synchronized way. So all this way, or to slowly train them and to inculcate. Like for example, one person is doing everything, and if the person is always having a negativity, hatredness, and other thing, even then the human body is a mind-body phenomena. It cannot go hand in hand. Even then, we won't get a good results. So to treat them both a mental component as well as the physical components together.
Right. So does the timing of the meal have any real significance? Like some people say, if you're eating after, say, sunset, it is not good for diabetes. All these things are common things which we hear. Is there
Yes,
any value to this?
that is like by evolutionary perspective, like by human beings have a human history of almost 2 lakh years. In 99% of the human evolution history, people have not eaten after 6 o'clock. See, even imagine a 50 years back, electricity came to India maybe in almost in 1980s, 50 years before. Even before that, most Indians were almost finishing their dinner early by 7 o'clock only. There was no concept of watching TV late night, eating in the late night. So, by evolutionary perspective, so we must finish your dinner early. That's the thing. But nowadays, what happened because of the lights, internet, TV, and all, there is dinner. But my always suggestion is if you're intermittent fasting, you finish your dinner early.
Right.
And something you're eating, and some professions are different. Some people like they want to awake late in the night and they'll get up late in the morning. Such people, okay, you can even have a dinner and skip your breakfast. But early dinner or skipping the dinner is always the best option because that's how our genes are tuned to.
So, just to follow up on that, have you noticed that anybody who works night shifts have a bigger problems with metabolic health?
I have seen many people in the early 30, early 20s who are continuously doing night shifts came to me with the diabetic itself. And recently, the guy is only 26 years old. He was doing night shift from last 3 years. And he came to me with HbA1c of 10. And he was not even that obese, but his only things are what is his light shift and he used to drink a lot of sodas. In the working in the night, he used to have some thumbs up, that, this, and all this thing. We just told him to cut down all the sodas completely and optimize sleep, told to change the schedule for some time and low carb diet. Within 3 months, his HbA1c was reduced to 5.8.
Right.
And initially, he started a small dose of medication. He started going low, hypoglycemic within 1 month only. Within 3 months, he achieved 5.8 HbA1c.
Mhm.
So this night shift again against our biological evolution.
Mhm. Right.
People used to sleep early in the night. Our ancestors used to sleep early. But if you sleep throughout the night, you're keeping against it, against evolution. For some time it's okay, but long time people doing night shift definitely affects your metabolism.
Right. So, I think in India itself, you can find different sort of treatments towards diabetes. Some of them may be true, some of them not. But anyway, like you said about reducing visceral fat, it's ultimately about reducing more, burning more fat. So you can, is it right to think that if you simply go on a calorie deficit, or if you are simply cutting down of any sort of calories, whether it is carbs or fats, you can sort of achieve this diabetes improvement?
No, no, no. It's what happens in this case in diabetic remission. The different macronutrients have different insulin response. So, for example, if you eat 100 grams of carbohydrate, your sugar spikes 100. I'm just giving a logical number. And to control that 100 sugars, again, pancreas will take a lot of insulin. So, carbohydrates drive more insulin from the pancreas. Suppose you eat 100 grams of protein and a fat, because I don't mention fat separately because most of the healthy proteins come with a fat. You take a paneer, nuts, red meat, egg, most of the healthy proteins come with a fat. So you eat a proteins, your sugar spike only 50 and the pancreas will secrete less insulin. Suppose you eat only healthy fat like some nuts, seeds, paneer like this, your sugar even spike 30. So the fat is the least stimulant of insulin. The next comes protein. The last is highest spike of insulin happens with the carbohydrates. Automatically, if you just reduce the carbs, having one idli in the morning and one chapati in the afternoon and one chapati in the night like that, so you're not inculcating proteins and fiber, and your insulin response is still high only. You're only getting malnourished. That doesn't the calorie concept of the weight loss or fat loss is okay, but before that you must maintain this macros, protein, fiber, and protein. Then, in addition to that, you can add that calorie concept. Otherwise, people are doesn't my I simply people telling that don't calculate calories. Always eat 80% full. Your body knows how much you require. Whenever 80% full, you stop it because this is a Japanese way of eating. So when you feel 80% full, stop at that. So more likely, that's how your body itself senses the calorie mechanism. And if somebody people got too much progressive loss, in spite of following this low carb, they're not losing weight. Then along with this low carb, you can add calorie concept. But more important is insulin hypothesis than calorie concept.
Right, doctor. So is diabetes reversal truly possible, or is remission a better term?
See, remission is a better term. I'm working on this from last 2017. So in my all the things and everything, because people who are less than 40 have an excellent response. Even they bought their HbA1c from 11, 12 to 6.5 within 3 months, 6 months like this. People in the 40, 50 has a moderate response. Some of them can sustain, they can bring the HbA1 to some level and their medication has been reduced. Complete remission, sustaining for a long time become difficult. People above 50s, I can say mostly your dose of medication will reduce. People who are taking already 4 medication for diabetic, by following a low carb diet and other things, you can reduce it to 2 medications or you can come to 1 medications. But completely reversal is little difficult because maybe what I feel above 50, along with this insulin, the pancreas also function also started declining slowly. It's not same for all. And in general, suppose somebody is in the 50s who maintained a good metabolic health and other things there otherwise, they can. But above 50, complete remission is little difficult.
R- Right, doctor. So the next question is on what markers define remission? What blood markers would define remission?
So the best thing is to your fasting sugar and after food sugar, you keep checking once in a week, and HbA1c. If you bring your HbA1c to less than 6, that means, and you sustain that at least for next 6 months, you can say we can brought it to remission. In addition, you can also check your fasting insulin. Suppose initially you had a very fasting insulin and that has become normal after 6 months and all, along with HbA1c. That's also an indicator of remission. Otherwise, for common things like just keep your fasting sugars and HbA1c is more than enough. And also, side by side, the loss of weight for obese people.
Right. So speaking about fasting insulin, uh, the lab ranges for fasting insulin is quite big. It's from 2 to 25 or something, and that is not the range we go by. So,
Yeah,
can
ideally,
you
the
just
fasting
clarity on
insulin
this?
for a pre-diabetic is 100 to 110 to 125.
Okay.
For a diabetic is above 125.
Mm-hmm.
So many people think that till 110 the sugar is normal,
Mm-hmm.
but that's not so. So as per many researchers, if the fasting sugar is anyway more than 100, you're already in insulin resistance.
And what about fasting insulin?
Fasting insulin, there are various there's no standard because you see, no, many of these reference engines in the laboratory they give up to 25,
Mm-hmm.
but the standard is what I recommend is less than 8, less than 4 is still best.
Right. Coming back to our diet part, Indian diet is mainly grains, right? Like we have a roti, and one thing I interestingly found out was that diabetes is more prevalent among the rice-eating population. If you look from all the way from South India, Kerala, Tamil Nadu, Karnataka, all the way towards Bengal, I think except for Gujarat, all of the rice-eating population have more diabetes. Is there a reason for this? It's very interestingly I found out.
So I do not think so because in North Indians also there are a lot of diabetic. If you take this Punjab and all, the diabetes is quite very high. Mostly the number of people who eat rice in India are more because South Indians will eat rice, East people will rice, West people will rice mostly only except the North part, the Hindi heartland. Rest most of the part rice is prevalent.
Mhm.
So second thing is rice is more refined compared to wheat. See the when I was speaking to my grandfather, he was telling that when they were kids, they were only growing red rice. Today's white rice is triple refined. So definitely the white rice, what we eating rice is definitely a very highly refined carbs. It's not good for a diabetic part. Similarly, the people are not eating a wheat. No, they're eating a wheat flour that contains a gluten. It is more poisonous than white rice. So
Right.
that's also equally bad.
Mhm.
Could be because problem in India is the data.
Yeah.
Remember, I know many people who come with the health checkups, no, only after they having done a health checkup for some purpose in the office, they don't come to know the HbA1c is high. Otherwise, the maybe what the diabetic incidence has per the data, the actual numbers are double.
Right.
Like other countries like America and developed countries, in India, the maintaining a data is very difficult because of the rural population. They won't even bother, and our healthcare system is also like this. They are not that
Right.
defined enough. So otherwise, I want to see practically I see patient from this and all. No, both wheat eating as well as rice eating, the incidence is more.
Right. So among the grains, like we are Indians generally will not give up grains very easily. So among the grains like rice, wheat, millets, and everything, what are the better options for a diabetic if you have to choose a few options?
The millets could be the better option than a wheat.
Mm-hmm.
Better option only in comparison.
Mm-hmm.
Ultimately, all are carbs only. We can't tell them to completely skip them because they're culturally used to it. Instead of wheat, at least go for a millets.
Right. So any variety of millets, or is it specifically something you have?
Nothing like that because there is multiple. The Siridhanya millets will come, ragi. Go for any mix of 4-5 millets as per your convenience. Okay, but ultimately it will make only 10% difference in glycemia. This one. And instead of white rice, at least go for a red rice, black rice, or some any unrefined rice. In Karnataka, we also get Kerala rice. I think if we convince the people from going from white rice to Kerala rice or Mangalore rice, that's also a good. But eat less, eat more protein and vegetables,
Mhm. Right.
and
Uh,
even something like a basin, little better than wheat.
mhm. And when it comes to protein sources, for non-vegetarians, what are the protein sources?
See, I recommend always this animal origin sources have best bioavailability. And as I said, the best protein is the one which comes with the fat. So paneer, Greek yogurt are the best source of protein for vegetarians.
Mm-hmm.
So next comes soya, but soya again is artificial, not good for man because it's ketogenic. And then comes whey protein. Second choice could be all these dals,
Right.
pulses, and other things because, as you know, dals also contains enough carbohydrates.
Mhm.
So when we are planning a low carb diet, the net carb will automatically increase when we keep on eating dals.
Mhm. So among this low carb trend itself, there is a trend of cutting down carbs too much and going into this keto carnivore sort of diet. So what is your thoughts on that? Is it the right way or
But
there are both of
I personally don't recommend keto because keto is like eating almost 90% as a fat, 80% fat, protein, and less than 5% as a carbohydrate.
Mhm.
So they see the body physiologically for a cyclical keto is okay. If you're following a
Mhm.
low carb diet, in between you can follow keto. But if you think in terms of body physiological perspective, so body needs all the three macronutrients, but more importantly, protein and fiber. You reduce the carbs intake to 20%, at 80% go with this, but eating only 80% fat and protein is something I don't recommend for a long time. Cyclical keto is very good. You can, suppose 3 months you follow low carb, maybe 15 days, 1 month you follow keto diet and continue that.
Right.
And it is not sustainable because I have seen many of the patients and all, even I tried. Only keto is difficult to sustain. As you said, the Indians are allowed to eat grains. But low carb is nothing like if you understand properly the concept of fiber, protein, and unrefined carbohydrate, it can continue for a long time.
Is there a number you can say, right? Like this much grams of carbs is a good limit, which people can follow in their mind. Like this is a good amount.
So uh, it is very difficult to exactly quantify. Actually, I'm not measured like this. I will tell that 25-30 grams of protein, around good amount of fiber, and you eat that 50% of the protein option you are what you're eating. If you're having some small bowl of any carbs, like suppose, for example, if you're eating a rotis, I suggest restrict to only single roti, single millet roti, and rice only if you restrict to small bowl of rice. That could be the approximate option. Because again one thing, no, for somebody is like a people who have need a large physical labor, they may need little more carbs. People who are sitting and working, office workers, they may not need much carbs. So like that, carbs is decided by your activity basically. So I tell them, suppose you're sleeping in the night, you don't need carbs. But in the daytime, if you're working like this, because you heard the concept of English breakfast. In English breakfast, they eat a lot. They give meat, eggs, so on. So there's a very big breakfast because the English breakfast was designed for a factory workers in 16th century. The laborers were made to eat a lot in the morning. They go to the factories. It was a hard work. They come back again at 5 o'clock and eat again second meal. So this was only the 2 meal concept that time. That was the breakfast terms. But depending on the activity, you design the carbs. If your people, a person is less active, less carb.
Right. So, doctor, do you integrate like conventional medicine along with the holistic medicine? And not every patient is very keen on doing holistic changes, right? Some of them will just say, "Give me medicine," and I'm okay.
Yeah, of course. That depends on the person model. Ultimately, what drives is a people motivation. So I'll assess them first whether the person is ready to reverse or not. Ready to reverse or is interested to reduce the dose of medication. If somebody is not interested, I'll tell them I'll just give the medication like what majority 80% doctors are doing in India.
Right. And what are your thoughts on these drugs like Ozempic, which are being used for weight loss these days? And are there any long-term side effects for these drugs?
Ideally, the Ozempic is not at all approved for the weight loss. It's approved for the diabetes only, but people are misusing it as a weight loss drug. So that's called initial fat loss. But see, any medication comes with the side effects. There's nothing like some people have, it can lead to pancreatic side effects and other things. Maybe the incidence is low, but medicine is a medicine. Any chemical, it has its own side effects in the long run. You cannot keep on continuing taking Ozempic for years.
Right.
Maybe for a short duration of time, if you're a pre-diabetic or obese, you can take it for a few months, reduce the weight, and ultimately, what you have to maintain your weight, matlab, you have to follow the diet.
Right. I think it's just like Ozempic has been repurposed from a diabetic drug to a weight loss drug. Similarly, bariatric surgery has been repurposed as a diabetic surgery. So these kind of things keep happening, but the focus should be on holistic wellness always, right?
Yes.
So moving on, uh, is long-term intermittent fasting, can people do it for lifelong, or are there any sort of precautions one has to take with long-term fasting?
See, intermittent fasting, example, like we can more precisely, we can tell them it's a pattern of eating. For example, you just recommend people to have a early dinner and a late breakfast. So naturally, you're fasting. For example, your ancestors they finished their eating by 6:30. And in the olden days, there was nothing like a concept of breakfast every day. And they used to have a late breakfast. So early dinner and late breakfast automatically intermittent fasting.
Correct.
So there's nothing new. Like now the term is this one. Like my grandfather used to finish his dinner by 7 o'clock. And today, next day morning, I used to go to the farm and he come back and having breakfast at 11 o'clock. He used to have a brunch. More than a breakfast, he used to have a brunch at 11 o'clock. So by naturally he was doing 16 hours fasting.
Right.
So if you make that as per your lifestyle, if you make that adjustment, automatically it become a pattern of eating. And something to be taken care of for long time people who are fasting, but don't go to extremes. Don't try to do every day 24 or 36 hours of fasting. And don't try to do fasting when you're already stressful. Because the fasting itself is a stressful state. If already you're some stress, physical or emotional something, avoid fasting. Otherwise, weekly 4 to 4 days, easily somebody can continue fasting.
Right. I think you mentioned earlier that people who are on medication should avoid fasting. Can you just elaborate a little bit more on that?
The commonly used medications in the diabetic are sulfonylureas. You might have heard this glycomet GP1, GP2, like this kind of things.
Yes.
These sulfonylureas are more prone to cause low sugars. And some drugs act up to 24 hours. If you take once, they act up to 24 hours. So doing fasting with these medication is not good. And second comes insulins. So whenever you're having any insulins, no, the chance of getting low sugar is very high. So people who are taking sulfonylureas and these insulins should must refrain from fasting. If they want to do fasting, I recommend not more than a simple 12-hour fasting. So more
Right.
than that, your sugar may vary and you're at high risk. Then comes DPP-4 inhibitor, SGLT inhibitors. If you're in a small dose of these medications, you can go fasting up to 12 to 14 hours. And if you're only metformin, a simple metformin drug, then you can do regular fasting. Metformin is less known to cause any low sugars, and you can easily do 56 hours fasting with the metformin. But again, people have to consult the diabetologist more precisely. If he has experience about fasting, that will be good. Because not otherwise, most diabetologists say if it's fasting method, they will just no, that's not taught for us. No need to do fasting.
True,
Right.
true.
So, one question I have is, uh, there is a lot of link, or there is a lot of research coming out between the link between micronutrient deficiencies like magnesium, chromium, etc., and diabetes. Do you think that is one of the reasons we have so much diabetes cases in India?
Yeah, these are all additional factors. As I told at the beginning, 70% we can attribute to diet. In the remaining 30%, all this will come. Chromium deficiency, magnesium deficiency, pollutants in the food, pollution we are exposed to, stress level, all this will come into effect. Definitely, we can't completely say no. All this will have an effect.
I think I saw one of your posts recommending these are like essential supplements. So, what are those essential supplements if somebody doesn't know much and he wants to not get into any deficiencies?
So there are. I always keep telling people at least five basic supplements. So one is nowadays the most important is vitamin B12 and D. You know, even if you do randomly blood test for somebody, you feel 50% people are deficient in vitamin B12 and D. So as per the reports, you take injection and tablets with a prescription of a doctor preferably,
Mhm.
because I recommend with the prescription only, because I don't recommend somebody taking vitamin B12 from the Amazon, because pharmaceutical supplements are more regulated compared to nutraceutical supplements. And next comes the magnesium, very important supplement, because the magnesium deficiency is mainly because of the lack of the degradation of the soils nowadays, and also lack of nutrient density in the foods. So magnesium is one of the supplements which is much needed. And fourth comes omega-3 supplements, one of the very anti-inflammatory food and which need for the heart and everything. And fifth comes is a probiotic. So probiotic is, we always our health depend on the gut. People like food is adulterated. People keep eating outside, food additives, so and so. So maintain your gut bacteria properly. At least you need a probiotic supplement depending on your lifestyle.
People will say curd is probiotic.
No, I don't think this is not enough. That's not enough.
Right.
But as the third is definitely a fermented thing, which is good. Still better is a yogurt. But
Mhm.
suppose, for example, if you're going out for a dinner, people have some drink or some other thing. Whenever you eat outside in the hotels and all, no, you see the color of the food. They will add coloring agents. They will have soup, sauce, and all other things. And so many ingredients will come into picture. When you're having so many ingredients like this, automatically your gut bacteria get disturbed.
Mm.
And for example, you're taking an antibiotic, and nowadays people simply taking this acid blocking agents like pantoprazole, esomeprazole, and all. When you're taking these medications, then automatically probiotic is a must.
Right. And for diabetics, is there any special, like this is questions which we get, is there any special exercises, right, which you can do maybe after a meal or something to reduce your postprandial response?
See, after food, some people have a very high. Suppose if you had little more carb in the dinner, in your dinner, I suggest for such people at least walk 10-15 minutes post dinner,
Right.
because we cannot. It's not good to exercise immediately after dinner or any lunch or anything. At least after dinner or lunch, just walk 10 minutes, preferably in the dinner times. Walk 10-15 minutes, not more than that, so that your sugar spike will get reduced.
Mhm. Right. Kunal, if I think we
Right.
can open up the
So one
audience.
of the, yeah, I'll do that. In the meantime, can you talk about omega
Yeah.
6, sorry,
Omega,
omega supplements for vegetarians, because a lot of vegetarians do not prefer fish oil and all those things.
yeah. That's the thing. That there's a lot of flax seeds and walnut is enough. Flax
Right.
seeds, regular intake, and the walnuts is a very good source of this omega 3.
All right. So we'll open up to the
And
audience.
also the chia seeds. See,
Correct.
the vegetarians, I recommend they must eat regular seeds and nuts. So they are the nutrition powerhouse.
Absolutely.
Mm.
So we'll open the questions to our audience. If anyone has a question, please type it, or you can switch on your mics and your videos if you like. Either ways. In the meantime, Doctor, can you tell our audience how to reach out to you and how to keep up with you on, online? How can people stay up with your work?
I'm in Twitter, but I'm not that much active in Twitter. And I have my YouTube channel. I keep posting some informative. Recently started. Otherwise, what happens is my most of time goes in practice only. So in the mini wherever the time's available, I make some videos and put it there. So in the Twitter, the inbox, and other thing, you can send messages if you have any queries.
Right.
Or there is a website also, drvishwanath.com. So that also, if anybody wanted to consult and all, you can reach out to me.
You are based in Bangalore, so where was your office?
I'm in JP Nagar, seventh phase.
Okay.
So I worked with all these corporates earlier. I worked with Manipal, I worked with Apollo. So, and I know in all the places, irrespective of the healthcare, the diet is the most neglected thing. I know in spite of the best hospitals, there was no concept of low carb diet. I see sometimes I was surprised to see diabetic people in the rounds, morning rounds, when I go to rounds, they're eating idlis, dosas.
So I think I have like a last question from my side. Like fasting insulin test, I don't think most doctors prescribe. Even if you go to a lab and ask fasting insulin, I think most of the time they will just tell it's fasting glucose and take that. So
Yeah.
why is this the case?
Because that is like uh, one is thing like lack of awareness about the preventive medications. In this as a curriculum now in the MBBS, it's surprising for you. For example, I studied 5.5 years of MBBS and 3 years of post graduation. In the entire 8.5 years, there was no subject on nutrition. So we are doctors are trying to learn the cause of disease and how to treat them.
Right.
So that's why this fasting insulin, home IR, and all more of a preventive aspects. But now this awareness is keep on increasing. It is more popular with the people who follow functional medicines and preventive medicine like that. But still, many doctors don't recommend it, and some doctors think that the reference range is not accurate. What reference range you think is not accurate, and many doctors doesn't believe in insulin concept of obesity. 80% population is still believing in calorie concept of obesity. When people who understand the insulin basis of the obesity and other thing, automatically fasting insulin become more important.
Right.
So doctor, I have this question that usually when doctors prescribe medications, it's usually the time to see a patient is quite brief. But when it comes to holistic medicine, the doctor has to kind of put on a coach's hat also, a health coach to guide the person, to give the knowledge, educate the person. So in these cases, like what are the biggest challenges you face? Can you
This
just
always quite happens in any practice, busy practice. Even I see when I see the patient, I for example, I cannot spend more than 15 minutes. So what we did is in my clinic, we have a separate low carb diet team. So I will explain about the synopsis of the diet and I'll optimize this medication and other things. I'll speak about reports and other things. Then for a diet follow-up, I'll refer to them because I'll tell them it needs separate follow-up. But some people is already having their own nutrition coaches and all. I will tell them, I'll give this guidelines, at least this much protein you require, this one, you consult them and follow the diet properly. Automatically in India, this problem is the people still not motivated enough to have this preventive medicine and all. And if you keep spending for half an hour, 45 minutes also, difficult to manage because the numbers also more wherever we go.
Absolutely. So anything else you want to share, doctor, before we wind up?
So maybe the most thing is the diet, instead of speaking about a low carb diet, we can have to start convincing the patient that, see, the nature has given 3 macronutrients: carbs, protein, and fat. Don't overconsume fat, at least eat them in equal proportion. Even if you eat carbs, protein, and fat in equal proportion, at least, automatically it becomes a kind of a low carb.
Right.
So don't do anything in extremes. Ultimately, motivation is the key. What happens in the today is, till 1980s, there was no diet guidelines at all. The first diet guidelines came to US in 1980. Imagine after diet guidelines came, more and more people becoming metabolically unhealthy and diabetic. 1980 to 2025, every decade, the diabetes is increasing 4 times.
That's true.
So indirectly, what I'm saying, we are living in a high technology era. We are living in a people where enough dietitians and nutrition coaches are there. Still, the incidence of metabolic problems and diabetes is increasing because one is lack of motivation to follow it, and people are eating and following a lifestyle without awareness. Like if somebody is eating idli, dosa, upma, paratha for a breakfast, that's it. And very few people will take an interest to know what exactly paratha contains. You see, no, the people, suppose if you somebody you've seen your circle, so if you want to shop for a shirt or some jacket, they know 10 brands. And if they're buying a car, they know the details from engine specification to the outer to the car company and all. But when you come to your own blood parameters, your own diet, what you're eating daily, the people have a least knowledge about it. It starts from the interest and motivation. If they have interest and motivation, then only they can increase the health span, not lifespan. Today I was saying in the ICUs, I keep saying 80 years, 90 years patients, they're in ICUs. Now that the lifespan is increasing. People live up to 90, 100 years also. But they live healthily only till 50, 60 only. As per the research, only the people spend 25% of their whole lifespan in diseases only. And if they can seriously have a motivation to follow this, they can live 90% of their lifespan as a good health span.
Right, doctor. With that, I think thanks a lot for sharing very, very practical and very valuable insights for our audience. And we really appreciate, giving us this time to come on our podcast. Thank you so much. We wish you all the best, and we'll keep in touch. So thank you, doctor.
Thank you.
So when they was messaged me in the Twitter, I said yes, because my intention is we have to spread this awareness more and more. I'm really thankful to you guys. Even though you're not from the medical background, you're doing your best efforts to do this one. And the Mind Muscle project, this was one of the best Twitter account where you're giving so much of details and all. Many times I wish to do like that, but I don't have much time to do this. This is really good. This awareness should spread. So I have spoken to many low carb dietitians and other things. And let's not make this low carb as another diet term. Let's address macros properly. That's all.
Right.
That when you address this body's macros as per the body physiology, that automatically it will become low carb.
That's an excellent message. Let's not start another diet culture.
Yeah. Because many people are averse to this diet concepts. So many people know the market has becomes like this, like every dietitian has their own diet and all. And we can say it's not at all a diet. It is the art of eating. You must be knowing. I tell my patients, at least after having this diet, counseling, everything, when you see the plate, you should be knowing what you're eating. What is your protein you're eating? What is the carbs? What is the fiber? What is the fat? If you have this basic awareness, by default, you continue that for a long time. Many people are not at all aware what is protein, what is fat, what is carbs. Many people think that I'll have idli with dal, I get 20 grams of protein per day, per particular meal. This is the ignorance even in the educated class. And this is a major suffering also. And even, I don't understand, many, even the best of the hospitals, even a simple low carb diet is not followed. They serve, imagine, you tell me any one hospital and tell them, in the big hospitals, they serve diabetic patient with the idli dosa in the breakfast. How it can be low carb? Because automatically it will spike the sugars. Because this concept needs to be widespread, and appreciate you people are doing this. And anywhere, any sessions like this, I'm always ready. Thank you.
Thank you.
Thank you.